So let's start at the very basic level of what community organizing can start as. So when any community organizing or community initiative begins, we need to have some type of advocacy around it or some type of attention around it. So advocacy is the exclusive and mutual representation of a client or cause in a form of attempting to systematically influence decision making in an unjust or unresponsive system. So most times if the system is responsive and it's just, we're not going to have a whole lot of advocacy to make changes towards it, because if the machine is working for the majority of people, then it's going to be difficult to change it. However, as social workers, we need to stand up for anyone and everyone if they're not getting their needs met in some way, shape, or form. So the purpose of advocacy is attempting to bridge the gap of what a client needs and what is actually being offered for that person at that time. So a lot of times systems are established for the majority of people, but the majority of people is not all people. So we need to make sure that if somebody's not getting what they need, we are bridging that gap. So it's the difference between equality and equity. Equality means everyone gets the same thing. Equity is what people, they get what they need to help fulfill their need in some way, shape, or form. So at this, we are trying to address a system that does not work for our clients or the people that we serve, and at times actually works against them or hurts them in some way, shape, or form. And as I'm saying this, a lot of systems could come into your mind, and we could spend a lot of time discussing a lot of systems and programs that are actually hurting people's ability to advance or get to where they would like to go. So our role in it is gathering support, awareness, and influence to help mobilize change, because we're only one person, but one person over and over and over is a large group of people. And as a large group, you're able to make more changes than you are at an individual level. So this can be done to help vulnerable or underrepresented populations to have a voice. So for example, protest, rallies, educational seminars, lobbying, working with clients to get information to better represent themselves, etc. So at the current climate of the world, we have a lot of this advocacy going on. A lot of people are coming together, a lot of people are calling out the unjust system that exists, and they are trying to get other people educated, fired up, and aware of what is going on from their perspective. And this could be done, and a lot of people have different opinions around it, but it's very awesome to see a lot of people come together, advocate, and social workers speaking out and standing up as well in this effort to bring people together rather than tear the system down or tearing other people down, because we want to stand up for the betterment of everybody. So community organizing is the way that we often get what we want to see within the community around it. So advocacy is just raising the awareness. The community organizing is organizing the community in the best way that we know how to bridge that gap. So we have sustained change, not just change for the moment. So community organizing is the act of engaging with a particular group of people, often that have common interest, a community in general that is interested, or organizations to empower change in some way. And the key detail is they have to be interested in the situation. Because if somebody's not interested, you're not going to be able to mobilize the change in the way that you would have wanted to in general. Same with individual clients. So that's how I often describe community work, is it's like working with an individual, but on a larger basis. So keep that in mind when we go through the different stages, but let's reel ourselves back in. So community organizes bringing together different influences or people that can influence change to promote a mutually agreed upon effort to promote or advance a particular issue in some way, shape, or form. Because when people know more and know better, they tend to do better, but it has to be on a mutually agreed upon basis. Because if you're not interested in something that I'm interested in, the likelihood of you wanting to stand up and advocate with and for me is probably pretty minimal. But we have to have an agreement on what we're trying to advance or see in the situation. So this is where a social worker helps to identify, coordinate, and promote the change or effort that we would like to see. However, we do not do it for our own interests. That is where we need to be standing up for other people. Yes, we can benefit from the thing that we're advocating for, but we're not going to be egocentric, meaning I'm going to let my ego drive me, or I'm the center of attention. And if I'm not benefiting in some way, shape, or form, my hands are up in the air and I'm not helping anybody. we need to make sure that we're mobilizing other people, not at the cost of other people as well. So the efforts are interested on advocating for other people, and inherently we can benefit from that, but we're not the main driving force in that. So there are two different types of ways of bringing people together. So that's bonding or bridging. So we'll start with bonding. So bonding, key emphasis on bond, because this person is already bonded together in some way, because it's a dense social network among social groups of people who are already linked together in direct ties. So if you are bonding with someone, you already know them. Why? Because there's the relationship and you're just reinforcing it and building it up in some way. So if you imagine somebody having a bonding event, everyone already knows everybody, and there's not any disproportionate entities within that situation. So they've had previous interactions and are related in some way or fashion to one another. So they're more comfortable, and people are more willing and able to reach out to people that they have a bonding type relationship rather than the second type, which is bridging. So a couple of examples of a bonding relationship may be churches, because they have the same interest most times. Small organizations that have the same vision or efforts or trying to mitigate or rectify different issues. Interest groups, so people that have similar interests or people that may have differing interests but want to fight for the same cause. So the person or a group of people have similar focus and efforts to promote change. And there are multiple different groups that we could identify here that would articulate this. And then bridging are loosely connected networks of large groups of people linked through indirect ties. So if you think of a bridge is gapping, or bridging is connecting two gaps to make it walkable, and a bond or connection would be established. So two things that were not inherently connected before, you can lay a log across it, and then you can walk across and utilize both platforms. So this is where people may not have had previous interactions, and they may be unrelated prior to this, but are interested in promoting the similar issues or accomplishing a similar goal. So this is often where a lot of interests start gaining momentum, because two people or multiple people that were unrelated come together, and then they have just an eclectic team now fighting for the cause. So for example, a multidisciplinary team. So the purpose of a multidisciplinary team is having multiple disciplines, let's say dentists, doctors, social worker, nurses, etc., come together to consult to benefit a client's health or well-being overall. But if you are all siloed out, you would not be able to best treat the client, or you may be over-treating or under-treating the client in some way. Another example would be Phil's study group. So like tonight, before you guys came here, you may have known a couple of people, but the majority of y'all don't have any clue who each other is. But I was able to bridge everyone together to have a similar interest, which is passing your exam. Well, hopefully you're here to pass your exam. But before, some of y'all may have had an idea of like who each other was, maybe not know directly, but now you are all in a similar place, having a similar goal, which is passing the exam or getting a better knowledge base on what community organizing or community interventions is and are. So that's where you have to think of just an eclectic group of people who had a similar interest, but they didn't know who each other was. But now that you guys are all together, you guys are resources for one another to benefit from each other's knowledges and experiences, etc. Another example is a political group, or anything that you can think of that was not initially connected before, but now they are connected in some way because they have a similar interest. So now let's walk through the different stages of community organizing. And as I stated before, the easiest way to think of community organizing is an individual client on a larger scale. So if you think about what you would do with an individual client, think about it as the community is your client. So the first thing that you want to do when interacting with a new client is to develop a rapport with them, or understand who they are and what they would like to accomplish with meeting with you. Same thing with community organizing. So the first step of community organizing is developing a reputation or rapport with the community. Because if the community does not have any clue who you are, the ability for you to help them is pretty minimal, or you're just coming in with big ideas and they're like, who is this person? What's their angle? Are they even able to help us in some way, shape, or form? So this is where we need to get to know the people in the community, such as key leaders, because if you're getting relationships with people that have prestige or clout already in the community, your ability to be able to connect to the people in the community is inherently going to increase. Also, influencers in the community and or people who are impacted, which we call stakeholders in the community or influenced by a particular issue or area of interest. So the people that are directly being impacted by the thing that we think we could mitigate or rectify or help mitigate in the future is going to be helpful. So if we're coming up to people and saying, hey, I think I can help you with this, and they're like, really? No one else has been willing or able to help me with this before, and I'm willing to listen to what you have to say. So we need to get to know the community and for them to get to know us so we can work and collaborate together to improve and identify a particular area of interest that they want to work on. So that is going to be the big detail here. Just because it's on a community level does not mean that we get to control or tell people what to do. We need to meet them where they're at and stay with what they want to do. And even though we have big ideas, we need to stay and make sure that what we are doing is meeting their needs. So we're meeting the community where they're at. So common ways to connect with the community are focus groups. So focus groups, an easy way to remember a focus group is key emphasis on focus. So this is where we're bringing people together to understand what would they like to focus on. So we may say, hey, we're coming here to help improve your ability to operate within the community. What are some things that you feel you could benefit from? Some people may say like food banks. Some people may say domestic violence shelter. Some people may say transportation. Some people may say like grocery store access, etc. But it's us coming together and asking the community directly, what are things that you would find helpful? Or let's say we are trying to increase transportation overall. We're just asking the community, what are ways that you guys transport right now? Or what are downfalls or negative or consequences of the transportation system right now? One-on-one meetings, of course. So if you're meeting with somebody directly, you're able to more focus on their experience, but you're not able to reach as many people as you would as if you were meeting with multiple people. But one-on-one meetings is an easy way to start snowball sampling. And snowball sampling is essentially, I talk to you, you tell someone else that I'm helpful, they tell another person that I'm helpful, they tell another person I'm helpful, and it just snowballs down. So if you picture a snowball at the top of a mountain, and every time somebody brings up somebody, it grows in momentum down the hill. The more people that are pushing or running after it, the more momentum and the bigger that the snowball gets. So word of mouth is one of the most powerful tools on the planet to get something known to other people that would have not otherwise known about it. So if you have a good impression on somebody, your ability to connect to other people that that person knows intensifies. Another way to do this is participant observation. So participant observation is where you become a participant in that person's community or around their experience and observe what it is like to be them or to walk in their shoes for an easy way. So it's literally walking in their shoes. So you're not saying like, yeah, I'll walk a mile in your shoes. You're literally living the daily life of what it's like for the people that you are trying to address and help in some way, shape, or form. And there are multiple different ways and mixtures that we could get this done as well, like surveys, etc. But the main goal is to identify strengths, resources, the dynamics of the community, issues, or the main concern that they have, the history of the community, to establish rapport with them. And again, if you walk into a community and don't follow the norms of that community, it could subsequently cause you your life if you go to the wrong place, the wrong time, or say the wrong things, or do different things that are going against the norm of that community. So if you're going to do community work, be wary of what you're doing. The second thing that we would want to do in community organizing, just as we would with an individual client, so we have the person's perspective of where they would like to go. This is where we need to figure out exactly what they would like to focus on at that moment, because sometimes the community has a ton of ideas and all of these things, but they only open up once they get to know you and have that rapport established. So The second step is to identify the issue or issues of concern for that community. And I can't say it enough, for that community. So you want to stay focused on what you need to be focused on, and it's staying within that moment at the time. So we need to stay focused on what the community would like to change or improve in their situation at that time. So this is where we need to know what they want to do so we can work effectively and efficiently with them. So we need to gauge their interest or motivation in changing the identified issue. So again, their motivation of change is the most important part. So a lot of times when you get buy-in or rapport with people, you feel like you can start dictating and tell them what to do, but we need to understand what is their motivation around an identified issue, because they may come to you and say transportation's a problem, but we don't even really want to work on this right now. So then we have to put it on the back burner and say, okay, so what would be most helpful in your situation? As well as we want to start assessing and exploring past attempts at the change or even current attempts to better guide our efforts, because we do not want to reinvent the wheel, but we don't want to keep inventing a wheel that has a hole in it and is popping and is not working. And we need to make sure that what we're currently doing is better, if not the same of what's currently going on as well. So once we have established that rapport, identified where the people want to go, that is when we start having to get into that treatment planning mode within that community. So this is where we want to set the goals and objectives. So this is based on the identified issue or issues of the community members. And I cannot say it enough. It is all based on what they want to do and where they would like to see themselves going. And an easy way to break this down is goals are the overarching change that they would like to see in their situation. And then the objectives are the ways that we can get there. So this is where we start laying the groundwork to make the intended change or impact on the issue or issues being experienced by the community. So goals, if you want to view it as a skeleton project, goals are the skeleton. So if you've seen a skeleton, the bones are very, very strong. They're sturdy. They can do whatever they want. But without the objectives, aka the practical steps to get the job done, or skin, it's not an entire human. So we want to have very, very specific goals, but most times when people set goals, they're not able to vocalize or verbalize what they would like to see in the objective. So people have big ideas, but they don't really lay the groundwork on how to get there. So the objectives are super duper important because they are the specific steps that need to be accomplished or to occur for that overall goal or goals to happen. So the social worker starts to identify resources, people, and the length of time that they believe will promote or accomplish the overall goal. So this is where we start conceptualizing and working with the community and saying, okay, so this is the goal and objectives that you've kind of set out. This is likely what a realistic time frame is. And this is where we kind of take the reins for a little bit and start helping the client conceptualize, or the community conceptualize, what is actually possible with and for their situation. So this stage starts to bring the life to the intended change or changes that they would like to see, and it helps to inform the community of what can be done to address the issue or issues. Because a lot of times, even in individual client work, they will come up with these immaculate goals and they want to accomplish all of these things, but we can't have to reality test it and say, we can accomplish all those things, but we have to make sure it's in a realistic time frame. And here's the needed steps that we could possibly need to get there. Or this is how long it could possibly take to get the resources needed to be able to impact the situation at that time. So once we've worked with the community and we've identified a treatment plan for that, we then need to identify and mobilize specific individuals and create a task team or a task force. So if you see a task force in the questions as well, this is what it's alluding to. So the task force are the people that are carrying out the task to get the goals and objectives carried out. So key emphasis on task, because their goal is to carry out the actual plan. So at this stage, we need to gather key members of the community to ensure that they're aware of the roles and to confirm the goals and objectives that the social worker has created based on the feedback of the community. So this is where we need to get specific and very intentional and deliberate within this, because prior to this, we've just built a rapport so people know who we are and they're willing to accept us. We got their ideas of what they would like to see. We started to develop something that was realistic within the situation, and then they're confirming what they want to see with and for the situation of the community. So they're like, yep, that sounds good. Let's get this going. Let's start collecting the resources and everything we need. But we haven't finalized anything yet. So keep that in mind. At these stages, things can change very, very quickly. So during this stage, the community members can critique or change any of the identified issue or issues and or how they would like to be addressed. So the goals and objectives can be pretty fluid within this time frame. So the social worker needs to confirm that the community members, leaders, influencers, and the other people being affected, aka the stakeholders, by the identified issue or issues are okay with the identified goal and objectives prior to moving on to the next stage. Because once we move on to the next stage, this is where we're finalizing the action plan to start leaping and putting in energy and efforts to make the identified issue or issue improved. So once we have gotten the okay from the community members and everyone that's being served, we then move on to the fifth step, which is developing and finalizing an action plan. So this is where we need to develop and finalize everything that we want to see happen and that the community is agreed on. So this is where the social work creates a detailed plan with steps, actions, and resources needed to accomplish the agreed upon objectives to reach the identified goal. So prior to this, we're just getting a framework of what we would need, what we have. We might have run a needs assessment to see what was needed in the situation. This is where we start having the rubber hit the road and start getting actions set into place. So this is where we identify potential barriers to accomplishing the identified goal or in the implementation of the objectives. Because at this moment, we can't predict everything, but after we've gotten all the resources and gotten all the people together that's going to do it, this is where we kind of create like a fallback plan of like, if this happens, this is how we'd address it in some way. So during this stage, we must enforce particular standards because, again, prior to this, we didn't really have a whole lot of structure. We didn't have measures. We didn't know what was going to work. We just had a plan, and we need to have procedures to guide the plan of action. Because, again, if we all have different ways of doing things or different things in our mind that we could do to make the situation better, we need to have standards, we need to have consequences, and we need to have different ways and frameworks of doing it. Because a well-oiled machine with different parts moving back and forth is not a well-oiled machine. So when you're delivering a community initiative or organizing program, you want to make sure what you're doing is actually accomplishing the goal set forth, which is what the community wanted to do. So once we get everything together, we then need to execute and evaluate the action plan. So this is where we're jumping into action and saying, did we accomplish what we wanted to see within our situation? So within this stage, this is where we start to deliver the resources, services, and strive to meet the identified goals by carrying out the objectives. This is where we start doing what the community wanted us to do and that they agreed upon us doing, and the task force is out in the community doing and carrying out the task. So this is where we're going to monitor and amend any issues with the effort or efforts that we're putting forth, and we need to plan to accommodate for any unforeseen issues because we identified the potential barriers in the previous step, but you don't really realize what the barriers or fallbacks of something are until it's actually being done. You don't realize what is happening or what things aren't working well because on paper, programs and things can look really, really nice, but it's only once you step into the field and start delivering, allocating the resources that you realize, whoa, this is not meeting the goal or it's not going to be sustainable in the situation. So this is where we need to gauge whether the plan of action met the goals and fulfilled the objectives that we set forth. Was the way that we carried out the program effective? Is the community satisfied? Are they not satisfied? Do we need to make changes for future efforts? Do we need future efforts, etc.? So this is where we kind of sit down and have that objective point of view of like, okay, what worked, what didn't work? Did we accomplish our goal? Did we carry out the objectives in an effective manner, etc.? So this is where we need to make changes if needed, or if we can just stop the program, or how do we make the program sustainable in the situation? So this is where we decide whether the issue is addressed, and if not, then we need to revisit a previous step And that previous step is likely going to be 2 through 5, because unless you really take the community off, you're not going to have to establish a rapport again with the community. But possibly, maybe when you launch the initiative, it kind of ticked everyone off, and now you have to rebuild the rapport. So if the community wants to continue addressing the issue or issues, that's when we're going to strive back to a previous step. But if they're no longer interested, that's where we have to carry on and just let things go on how they're supposed to go. So there are 3 different types of community organizing. So they're very distinctly different, but we can utilize the name of them to remember and recall them on the exam, because it's not memorizing things that we want to have happen. We want to be able to recognize and apply them to the actual exam. So social action is the first one, key emphasis on action, because this is where the social worker is going to leap into action and make the intended change that they want to see or the community wants to see in the situation. So social action is where the social worker assumes that there's an exaggerated or disadvantaged group of people or segment of the population that needs to be organized to make demands on the larger society to get their needs met. So we're taking that view of like, if no one does it, I need to do it because this is a huge thing. So this could come from the lack of resources in a community, the lack of rights among people, and or unfair treatment that exists among a group of people, etc. Because this is where we leap into action and say, if someone else doesn't take action, I'm going to, because we need to see changes within this situation. So this is where the social worker believes that this particular group of people needs assistance, but the overall society is the one who will be providing the assistance. So we just kind of jolt into action, make changes, and keep fighting and keep going until our advocacy or initiatives are taken off, and then the overall society is going to take over and start sustaining what we have implemented in the situation. So key emphasis on action, because the social worker is going to be doing the action to get the job done. The second type is locality development, key emphasis on local, because this is where the locals within the community are going to make the changes on their own. So this is often a neighborhood-based strategy utilized to engage a diverse group of people or stakeholders, which are the people that are interested in and or affected by the identified change or cause within the situation. So this is where the community is going to say, this is an area of interest for us. We need to develop our own goals and carry out the own objectives within this. So they're taking action for themselves to see the needed changes that they want to see in their situation. So that's why the key emphasis is on local, because a local community making changes for themselves. So the main goal here is to develop a sense of collaboration amongst the community members and their ability to address any issue or issues that can affect their own community. So this is people saying, we're tired of all of these issues or this area of concern. We're going to start taking things into our own hands to make our situation look like how we want to look. So a social worker does not have to be involved within this type of community organizing for it to be effective and efficient. So oftentimes the community is taken upon themselves to address the issue. So social action is where we leap into action for the community. Locality development is where the community has taken things into their own hands to make their situation look how they would like to look. And then the last type is social planning. So key emphasis on planning. So this is where the social worker is going to make the plans for the situation, but at the end of the day, the community is going to carry it out on their own, or other people within the community are going to carry it out. So this is where a social worker will assist with making a specific change or impact for an identified community. So it can include formal planning or policy development for initiative or distribution of goods, services, or both to satisfy a need. So we come up with making connections and partnerships within the community, but the people that we've made the connections and partnerships with, those people are going to be divvying out the resources and etc. So an emphasis is placed on the interest of the participating agency or agencies within the community that are directly impacted by the issue or issues that they've identified, and it does not hone in on particular self-interest or residents of a community. Because again, community would be locality development. So this type of community organizing will direct directly impact a particular segment of the community at large rather than a particular community or residents of one community. So it's overarching and helping a lot of people, but the key emphasis is on the social worker assisting with it, but they're not the ones that are taking the burden and jumping into action to make this happen. So this looks to benefit the entire community or society, not just one segment within that. So kind of to quickly go over the three types again: social action, key emphasis on action because the social workers leap into action to make the needed change for the community or society. Locality development, key emphasis on local because the locals or the community itself is going to start making changes within for their situation. And social planning, key emphasis on planning because the social worker helps with the planning or developing of the situation, but somebody else is going to be carrying out the initiative at large. So now let's move into different concepts related to community organizing. So coalitions, key emphasis on collate, or if you look closely, it's like collate, because this is where we're going to have diverse people come together to accomplish a particular goal. So this is where kind of like that bridging concept comes in, but this is at large of developing an organization. So this is where a diverse organization or group of people develop an organization, join together to accomplish a particular goal or attempt to address a particular issue or issues at hand. So it's the collaboration amongst a group of people that helps to accomplish a goal quicker than if they did it separately. So it's not that the groups aren't capable of making the job happen, but when you have many people doing the same thing, it's going to help rectify and speed up the progress that we want to see in the situation. Lobbying, key emphasis on lobby. So this is where somebody is going to be staying in the lobby of the politicians to make things happen. So this is where somebody is like, I am going to try to influence public policy by developing and implementing strategies to persuade people of power. So I'm going to stay in the lobby, aka that waiting for them to get out of the meetings to help influence a particular area that I feel is important. So this persuasion can help vulnerable or underrepresented populations get their needs met by monetary values, etc. But an easy way to remember that is coalition is where we collate people together, because when we're bonded together, we're stronger. And lobbying is where we're staying in the lobby waiting for the politician to come out of their meeting so we can directly interact with them to help rectify or recognize an issue or issues that are impacting people that we care about or serve in some way, shape, or form. The next part that we will go over is case management and the different stages of case management as well. So case management overall is a process that seeks to advocate for and monitor services to help empower and improve a client's situation to reach their highest level of functioning possible. And that's going to be the huge detail, is we are trying to help a client reach the highest level of functioning that they possibly can by filling in the gaps of services that they're not getting or areas of their life that are underserved, so that way we can help make their situation more well-rounded. So this is where social workers try to limit any barriers or obstacles in the ways of a client's needs or need or want or wants in their situation. So the main goal for case management is to optimize the client's functioning and well-being by providing and or coordinating services in the most efficient and effective manner that we know how. So people have strengths, but they may not know how to mobilize or utilize them, or they may not know how to mobilize or utilize the different resources available to them. So we're going to help manage them and get them to where they want to go. So we try to strengthen and development, problem solving, and coping capacity or capability, so that way they're not always in services for the rest of their beings. So we want to increase the availability of community involvement within a client's situation, because the more exposed and well-oriented they are within the community, the more they're able to utilize the resources that are available to them. We need to increase the scope and capacity of their service delivery, and we attempt to contribute to an increase of access to services and level of functioning for the client to ultimately, again, help them reach the highest level of functioning possible within their situation. Again, people have ceiling potentials, but our job is to help mitigate or reduce the amount of barriers to them progressing in where they like to see. So let's segue into the different phases of case management. And this is where it can be kind of tricky because the terminology can overlap and sometimes people get really, really confused and say, well, I thought this is what this meant. So hopefully by the end of this segment, you'll have a better understanding of this. So intake or screening is where we are going to start screening them to see if they are appropriate and eligible for services. So most times people are like, well, I thought the intake assessment was that first initial meeting with them, and that's where I start developing and gathering the biopsychosocial assessment information, but that is not always the case. Intake or screening is that initial interaction with the client prior to us being able to assess and address what they need. So we need to say, are they eligible for services at this moment? So it's a process of reviewing key information related to the client's situation to determine what a client wants to gain and what they can actually gain from services. So it's the initial interaction where a social worker will identify areas of interest and the appropriateness for treatment. The social worker will determine what the client's needs are and what benefit they can get from the services, because if they're not found eligible or we don't offer the services that they need, we're not ultimately going to gather more information about their situation because we're not going to ultimately work with them on a long-term basis. So this is where the social worker will begin to identify useful resources within their agency and or at other agencies to best address the client's needs and or wants in the situation. Because again, if we don't offer the resources and services they need at our agency, we're going to refer them or facilitate a connection to another professional in the community to help address what they want. However, if they are found eligible, we are then going to move into the assessing or needs assessment type phase. So assessing, key emphasis on assess. Why? Because assess is going to be a deeper level of gathering information. So this is a continuation of the data collection completed during the first stage, intake and screening phase. So this is a more depth exploration of the client's situation, since we need to effectively assist them and they are a client at our agency and or in services. So they are now a client within our agency. In the intake and screening, we are seeing if they are eligible. So this is where, when they are a client, we want to get a thorough analysis of what they're bringing in, what strengths, what resources, what is the knowledge they have around what they're presenting with, and then going from there. So this is where a social worker will gather information on the following areas about a client. And this is not an exhaustive list, but maybe past and current physical health status, previous treatment history that they've been through, what is their understanding of treatment services, what is their socioeconomic status, what is their substance use history, are they currently utilizing substances, or do they have a legal history, do they have a current legal situation going on, what is their mental health symptoms, what was their previous health or mental health symptoms, are they on medications, do they want to be on medications, what is their housing situation, do they need housing resources, do they have transportation, do they need transportation, etc. So we are completing an integrated biopsychosocial assessment, or an IBA, to best understand what the client is bringing in, what they've been through before, so that way we can help mobilize and again get them to the highest level of functioning possible within this situation. So the goal is to get an understanding of the client and how we can best supplement their current strengths and resources to get them to the best possible functioning. So the primary goals of the assessment is identifying a baseline and what the client needs, or what need they have, or what wants or want they have in their situation. And we're going to start gathering information on the available resources and strengths that the client has and what additional services that they would benefit from to strengthen the strengths or help them develop new strengths in their situation to accomplish their identified goals. So once we have gathered all of that information, we are then going to move in to the treatment planning phase, or the planning or service planning phase. So key emphasis on plan. Why? Because this is the plan or framework that we are going to help them follow in their situation throughout treatment with and for us. So this is when the social worker and client develop a treatment plan to help the client meet their identified need or needs. So again, a goal is a measurable overall overarching thing that they have in mind. So it can be an overall need or needs, or a want or wants. that the client would like to accomplish in their situation. So again, it may not be entirely possible to help them get into the situation, but we need to meet them where they're at and understand what we can provide to help increase their capacity or capability to accomplish that. And we do that based on an objective or objectives, which are specific and measurable actions to help the client get their identified need or wants met. So these are the practical steps that have to happen to accomplish the goal. And once we get what the client has, what they need to help doing it, we then need to do the dang thing, which is the implementation. Key emphasis on implement, because this is where we are going to propel and push the client to implement the objectives to accomplish their overall goal. So this is the delivery or execution of the plan that the client and the social worker identified in the planning phase, which was the previous phase or stage. So this is where the identified objectives are being introduced into the client's life to help them reach their identified goal or goals. So the social worker will organize, integrate, and coordinate the service delivery as needed for and with the client. Because most treatment is not going to be pretty seamless of, all right, so you've identified it, let's start carrying it out. All right, you've done it for 5, 6, 7, 12 sessions. All right, bye now, and you're done. There's going to be some resistance. There's going to be some regression. There's going to be some pushback in the situation. So we need to walk with the client in the best way that we know how to help them get to their identified goal. So this phase allows for the client to have self-determination, which is an easy way to remember self-determination is it's how we help the client determine what they want to see for themselves, and independence within their situation to help promote the identified change. So this is where we're allowing for them to identify the speed, the pace, and what goals that they have and how they can make amendments to the objectives as needed. And once we move into the transitioning, key emphasis on transition, this is when we start transitioning them or having them transition from where they are in treatment to a higher level of care, lower level of care, or staying at the same service level. So this is where we start to sit down and objectively look at, did you reach your intended goal? Did you execute the objectives in the way that you thought? How do you maintain the progress that you've made, if you made any progress? And where do you need to go from here? So this is the phase where we will be prepared for discharge, transition to a different level of care, or have a continuation of the current level of care, depending on what happened during the implementation phase. So the goals and objectives will be reviewed, and the appropriateness for services and treatment will be determined, because if someone doesn't need further treatment, continuing on with treatment would be unethical in some way, shape, or form. So the social worker and client share a mutual goal of wanting to help the client become more independent and sustain their improved level of functioning, which is the best level of functioning that they are capable of at the situation. So this is where we kind of have to be that soundboard of, yes, you may want additional services, but it may not be 100% needed based on the fact that your quality of life has improved in some way. So this is where the client's treatment and progress and/or regression will determine the appropriate clinical decision-making process. And the key emphasis is on clinical, because we do not want to let our personal feelings and views of a client's situation interject on us doing our best clinical job. Yes, clients want to stay in services longer than maybe they should, but if they're not clinically warranted or there's not a clinical necessity, we then need to ship them out, discharge them, or put them into a lower level of care if that is clinically appropriate or relevant, which then segues us into the last phase of case management, which is follow-up and evaluation. So this is where we are going to follow up with the client after they have already been discharged to see how things are going and if they've maintained the changes that they had done during the implementation phase. So this is when the social worker will reach out to inquire about the client's current situation to gauge their level of function. Do they maintain? Do they progress further? Or do they regress back into old behavior upon discharge and or the level of care change? So the social worker will gather feedback from the client around their experience while in treatment, as well as post-treatment. So the purpose of this is to help impact future clients' experiences or make an amendment to the program that we had done or the way that we deliver services, or it could be a way for the client to re-engage in services if they had regressed or there was a clinical necessity to them re-engaging. So the social worker will provide additional resources as applicable to the client to ensure that the client maintains or has the best level of functioning. So the social worker will gauge the effectiveness of services based on the feedback from the client and the client's treatment outcomes in some way. And then from there, the social worker will work on the current system and present results to promote change or impact future client outcomes as needed. Because again, if the program didn't work for this client and they're providing us feedback and then we make the changes for future people and it still isn't progressing, we may have to strip down the entire program, make the changes, and then see what we would like to see. Or if the client has progressed, we would not make the changes based on the program was efficiently and effectively working for clients to reach the best possible functioning, because again, that is the goal of case management. Question 1. A case management social worker is meeting with a 36-year-old female outside of an abandoned building upon referral from an anonymous caller stating someone has been roaming the streets asking people for money. The social worker begins gathering information about the client regarding their current housing, employment, and supports. Which phase of case management is the client and social worker currently in? A, screening, B, assessing, C, planning, or D, implementation. And when you have your answer, type the word happy into the chat. Opening the polls. Twenty more seconds. Shutting down the polls. The majority think it is A. Second place is B. No one thought C or D. Let's look at it. We are a case management social worker. We're meeting with a 36-year-old female. So that is our client. We're outside of an abandoned building. And this person was referred to us from an anonymous caller stating someone has been roaming the streets and asking for money. So this is our first time meeting the person. So we start gathering information about their housing, employment, and supports. So we start getting to know who the person is at this time. So what phase of case management is the client and social worker currently in? So let's break down each of these phases and then compare back to the question to see which one connects best at this moment. So screening is the initial interaction with a person where we begin to gather information to help gauge their appropriateness for treatment. And then assessing is when we gather information about a client after we deem them appropriate for services. So we identify resources, strengths, and the history. And then planning is when we identify goals and objectives to help the client achieve their best level of functioning. And then implementation is when we execute the identified plan or goals and objectives. So quick review, case management social worker, 36-year-old female. We're outside an abandoned building. We were referred by an anonymous caller. It's our initial reaction or interaction, and we're gathering information about a client regarding their current housing, employment, and supports that exist within their life. So we are going to rule out D because we're not able to implement a plan with someone that we just met. We don't know what their goal is or how we can help them get to the best level of functioning. So it's hard to identify or execute something that we haven't really developed with the client. So we'll also rule out the planning because we're not planning or helping them reach their best level of functioning or their overarching goal and identifying practical objectives to help them reach there. So are we doing A, screening, or B, assessing? So screening is that initial interaction with somebody where we have to understand, are they appropriate for services? Do they want to engage in services, etc.? And then assessing is when we already deem the person appropriate and they're understanding a deeper level of what the client's bringing in, what's their strengths, what's their resources, and what is where they want to go. So we're going to rule out assessing and go with screening because it's our first interaction with the person upon referral from an anonymous caller. So it'd be different if we had been meeting with the person or we interacted with them before, or we were already on the scene and was like, yep, this person would qualify for services. So screening is where we see if they can get through the screen, and then we start assessing. And then from there, we would start planning, and then we would implement and then transition and then follow up and evaluation. So the correct answer here is A, screening. So that's how we look at that question in particular. Question 2. A social worker in a family agency has been working with a 45-year-old male for 8 months to help him get custody of his children back. The man has a history of alcohol use, and when he used to drink, he was abusive towards his girlfriend and his children. The man has maintained sobriety since being in treatment and has identified positive strategies to help him better handle his anger. The social worker feels the man is ready for discharge. Which phase of case management best explains the man's situation? A, planning, B, implementation, C, follow-up and evaluation, or D, transitioning. And when you have your answer, type the word hope into the chat. Opening the polls. 20 more seconds. Shutting down the polls. The majority think it is D. Second place is A and C. Third place is B. Let's look at it. We are a social worker in a family agency. We've been working with a 45-year-old male, so that is our client, for 8 months, any length of time. Hop on top of it because it paints the picture of what we're looking at. And his goal is to help get custody of his children back. The man has a history of alcohol use. When he used to drink, he was abusive towards his girlfriend and his children. The man has maintained sobriety since being in treatment, which is 8 months, because he's been seeing us for 8 months. So since being in treatment, he's been utilizing positive strategies to better handle his anger as well. So he's doing well. So the social worker feels the man is ready for discharge. So we feel that he is ready to get out of here. So which phase of case management is this? Let's break down each phase and then compare back to the question to see which one connects in the best way. So at this moment, we're looking at planning. So planning is when we identify the specific goals and objectives that the client would like to do to reach the best level of functioning. Implementation is when we execute the identified plan, which is the goal and objectives. Follow-up and evaluation is when the person is out of treatment and we gauge their level of functioning to better equip them. And then transitioning is when the person is preparing for discharge and we are evaluating their progress on the goals and objectives. So quick review: family agency, 45-year-old male, 8 months. He wants to get custody of his children back. He has a history of alcohol use and he was abusive towards his girlfriend and children. But since being in treatment, 8 months, he has identified positive strategies to maintain sobriety and handle his anger. And we feel he is ready for discharge. So right off the get-go, we're going to rule out planning because we're beyond the planning phase, because planning would be like, all right, so what do you want to do at this time? But since he's been in treatment for 8 months, he's carrying out and utilizing positive strategies to better handle his anger and to maintain sobriety. He has done that, and those were his goals because he wanted to get custody of his children back. So we're not planning anymore because he's carried out the plan. We're beyond the implementation phase because he's already been carrying out and has sustained different strategies and techniques throughout treatment. And then we feel he is ready for discharge. So that means he's been having progress and maintaining the progress that he's had over time. So are we looking at follow-up and evaluation or transitioning? Follow-up and evaluation would be where the man is already outside of services. Transitioning would be where we think he's ready for discharge, but we want to gather his perspective of where he's at. So that way we can make an informed decision. So we're going to rule out follow-up and evaluation since he's still seeing us, and go with transitioning because we feel he's ready for discharge, but we need to get his perspective around his current situation to see what and where he would need to go or how we can help him maintain the progress that he's made post-treatment. So the answer here is D, transitioning. So that's how we look at that question in particular. Question 3. The community social worker has been working with members of his community to help reduce the amount of human trafficking that occurs in the area. The social worker has formed a partnership with the local hardware stores to provide flashlights and neon green safety vests to interested members of the community to help reduce the rates of abduction at night. What type of community organizing best explains the social worker's intervention? A, social planning, B, social action, C, locality development, or D, harm prevention. And when you have your answer, type the word coffee in the chat. Opening the polls. Twenty more seconds. Shutting down the polls. The majority think it is B. Second place is C. Third place is A. Fourth place is D. Let's look at it. So we are a community social worker. We're working with members of the community to help reduce the amount of human trafficking that occurs in the area. So that is the goal of us helping the community. The social worker has formed a partnership with the local hardware store to provide flashlights and neon safety vests to interested members of the community. So that is something that we did to help reduce the rates of abduction at night. So that's the purpose of that. And what type of community organizing best explains the social worker's intervention. So let's break down each level of community organizing and then compare it back to the question to see which one connects. So social planning is where a social worker helps out the entire community and initiates resource delivery and implements change. So emphasis on planning. And then social action is where a social worker will assume that there is a disadvantaged group of people not getting their needs met. So they put forth effort or action to help them out. So the emphasis on action. And then locality development is where key stakeholders or people that are impacted by an issue attempt to bring everyone together to help solve an issue or to bridge a gap in a need. So the community does it themselves, and then harm prevention is something that I just added up for filler. So I made it up. So quick review, community social worker. We're working with members of the community to help reduce the amount of human trafficking that occurs in the area. We had formed a partnership. So we formed a partnership, and the local hardware store is the one that is providing the flashlights, neon safety vests to interested members of the community with the intention to help reduce the rates of abduction at night. So right off the get-go, we're going to rule out D of harm prevention. Yes, we want to prevent harm, but that's not a type of community organizing that exists. So is the community the one that is doing the action? Are we doing the action, or did we help just with the planning phase? So let's look at it a little deeper. So right now, we had formed a partnership with the local hardware store, and the local hardware store is the one that is providing the different resources. So right now, we're going to rule out locality development because the community didn't do it amongst themselves, or the community is not doing it. So we're still involved in helping with the service delivery in some way, but we just formed the partnership and now our hands are off. So are we doing the action to help the situation propel, or were we just in the planning phase and let someone else take over at this moment? So right now we're going to rule out social action because yes, we put forth action, but we're not actively on the front lines handing out the flashlights and safety vests to other people. So we were just a part of the planning of establishing the partnership, but now the hardware store is the one that is divvying it out. And locality development would be where the hardware store took it amongst themselves and being like, yeah, let's donate some of the stuff that we have at this time. Social action, the social workers out in the community handing the stuff out. Social planning is where we are in the planning of the initiative, and now if someone else is taking over. So the correct answer here is social planning. So that's how we look at that question in particular. Question 4. A social worker in an outpatient clinic is asked by his supervisor to investigate their community's current efforts to combat rising rates of overdose deaths. The social worker finds out that there's a group of citizens that have been handing out Narcan and providing informational panels to community members every month. The social worker plans to reach out and contribute to the already established efforts. What type of community organizing would this be considered? A, locality development, B, social planning, C, social action, or D, community development. And when you have your answer, type the word Michigan in the chat. Opening up the polls. 20 more seconds. Shutting down the polls. The majority think it is A. Second place is C. Third place is B. Fourth place is D. Let's look at it. We are a social worker in an outpatient clinic. We are asked by our supervisor to investigate the community's current efforts to combat rising rates of overdose deaths. So the social worker finds out that there's a group of citizens that have already been handing out Narcan and providing informational panels to community members every month. And the social worker plans to reach out and contribute to the already established efforts that they've seen. So let's break down each level of community organizing and then compare it back to the question to see what we're looking at in the situation. So locality development is where key stakeholders or people that are being affected attempt to bring together everyone to help solve a problem or bridge the gap between a need. So the emphasis is on the community or locals doing the actions. Social planning is where a social worker will help out the entire community and initiate resource delivery and implement change. So the emphasis is on planning. And then social action is where a social worker will assume there is a disadvantaged group of people and put forth effort or action to help make change in their lives, and then emphasis on action, and then community development. Phil made this up just to have filler in there. So quick review, outpatient clinic, we're asked by the supervisor to investigate the community's current efforts. So we're investigating the community's efforts on getting the job done already at this time around the rising rates of overdose deaths. We found out there's a group of citizens, so people in the community are already doing something by handing out Narcan and providing informational panels to community members every single month. And we want to contribute to the already established efforts at this moment. So we're not helping anyone develop anything. We're not helping anything plan anything. It is already existing and we are falling into it already. So keep that in mind as we navigate the different answers. So right off the bat, we're going to rule out community development because community development is not a type of community organizing, and it's a nice word that kind of has community in it, but we can't just assume that is a type of community organizing. We're also going to rule out social action because the social worker is not putting forth any action. Yes, we're putting forth action by investigating, but we're not the one that's handing out Narcan. We're not providing the informational panels, as well as we're not doing a whole lot to help combat this at this moment. We want to join the already established efforts, but that would be us piggybacking on top of it, not developing it ourselves and handing it over. So for that same reason, we'll also rule out social planning because we're not helping anyone plan anything. We're planning to join an already established effort, but we're not creating efforts or helping people organize it or do anything at this moment. Maybe when we join, we could do that. However, the locals or the community already started combating and taking initiative with and for their situation to get the job done at this moment. So the correct answer here is going to be locality development because the community already has efforts going. It's a group of citizens that are a part of that community as well as is an already established effort. So for that reason, the correct answer here is locality development. So that's how we look at that question in particular. Question 5. A home-based social worker is meeting with a couple and their 5-year-old son for their routine monthly appointment. The social worker has been working with the family to help the parents improve their relationship and to help the son address issues he has been having at school. During the most recent visit, the social worker finds out that the mother has lost her job, which has caused the family to not have enough money to buy food this month. The social worker provides a list of possible food banks in the area for the family to utilize. What type of advocacy best explains the social worker's actions? A, bridging, B, bonding, C, lobbying, or D, collaborating? And when you have your answer, type the words go blue in the chat. Opening the polls. Twenty more seconds. Shutting down the polls. The majority think it is A. Second place is B. Third place is D. No one thought C. Let's look at it. We are a home-based social worker. We are meeting with a couple and their 5-year-old son. So those are our clients. And this is a routine monthly appointment. So this is something that we've been doing for a decent amount of time. The social worker has been working with the family to help the parents improve their relationship and to help the son address issues he's been having at school. So they're very active in getting progress done. So during the most recent session, so this is happening right now, or the most recent visit, social worker finds out that the mother has lost her job, which has caused the family to not have enough money to buy food this month. So they have a basic need that's not being met. So we step in and provide a list of possible food banks in the area for them to utilize at this given moment. So what type of advocacy best explains what the social worker's actions are? So let's break down each of these types of advocacy and then compare it back to the question to see what we're looking at this time. So A, bridging, is where we bring together loosely connected networks of people to help benefit and satisfy a need that someone has. So it is indirect ties at this moment. And then bonding is where we bring together or strengthen already established relationships to help bring about change from the connection. So the emphasis here is the direct ties. And then lobbying is the process of influencing public policy by persuading people of power to influence the situation. And then collaborating is working together with people on a common goal, as well as Phil just added this in. So quick review, home-based social worker meeting with the couple and their 5-year-old son. It's a routine monthly appointment. We've been doing this for a decent amount of time. We initiated services to help the parents improve their relationship and help the son address issues that he was having at school during the most recent visit. So this is happening right now. The social worker finds out that the mother lost the job. It caused the family not to have enough money for food. We're like, we don't want you to go without a basic need. We then provide a list of food banks in the area for them to utilize. What type of advocacy did we have within this family unit? So right now we're going to rule out collaborating because yes, we are collaborating with the clients to get the job done, but we provided them a list of food banks. So we're not driving them to the food banks. We're not doing anything like that. We simply just said, hey, here's some food banks in the area that you could benefit from if you would like to do so. We're also going to rule out lobbying because we did not bring any people of power to like get her job back or anything like that. We didn't increase like the food benefits or like food stamp assistance or anything like that because lobbying would be more directing a macro level, and this is more of a micro interaction with the client. So did we bridge, meaning connecting two things that weren't already connected, or are we bonding and bringing up resources that this lady already had and had been utilizing in the past in some way? So right now, since we provide a list of possible food banks in the area, it kind of tells us that this person hasn't initiated or went to a food bank before this interaction. So we're going to rule out bonding because this lady doesn't have direct ties, and if it was more of a bonding situation, the social worker would bring it up and say, hey, you could go to the food bank that you guys went to in the past and receive food services or benefits in some way. So bridging is where we connect two things that weren't directly connected prior. So if we provide her a list of possible, key emphasis on possible food banks in the area, we are informing her or the family in general of the food banks that they can utilize so that way they have food for the month. So the correct answer here is going to be bridging. So that's how we look at that question in particular. Question 6. A community-based social worker has been collecting data around the rates of homelessness among transitional aged youth in our community. The social worker would like to implement strategies to help decrease homelessness and increase community involvement around the needs of vulnerable populations in our area. What should the social worker do first to accomplish her goals? A. Identify clear goals and objectives that she would like to accomplish before sharing them with the community. B. Continue to collect data to ensure that she has adequate evidence to back her goals. C. Engage members in the community to help bring about change among the homeless youth in the inner area. Or D. Speak with homeless transitional age youth to better inform herself about the issue. And when you have your answer, type the word joy into the chat. Opening the polls. Opening the polls. Or 20 more seconds. Shutting down the polls. The majority think it is D. Second place is C. Third place is A. Fourth place is B. Let's look at it. We are a community-based social worker. We're collecting data around the rates of homelessness among transitional age youth in our community. The social worker would like to implement strategies to decrease homelessness and increase community involvement around the needs of vulnerable populations in the area. What should the social worker do first to help accomplish the goals? So this is going to be an application question. So we can utilize the acronym to break it down. And for those that don't utilize the acronym, I'll utilize the question to get to the answer first, and then I'll utilize the acronym to confirm it and see what we're looking at this moment. So right off the get-go, we're going to rule out A because yes, it's identifying clear goals and objectives, which is a part of developing a community initiative, but it's focused on what she would like to accomplish, not on what the community would like to accomplish at this moment. And our target population is transitional age youth. So we're not going to base it entirely off of what the social worker thinks, because in the community work, the community is the most important factor within that situation. We're also not going to continue to collect data because yes, we wanted to be data informed, but we're not going to back our goals because it's going to be focused entirely on what the community wants, not what we want, as well as we want to meet with the target population, the transitional age youth, to see what's going on with and for their situation. So we can either do C, engage members in the community to help bring about the change among homeless youth in our area, or D, speak directly with the homeless transitional age youth to better inform herself about the issue. So at this moment, we are going to rule out C because yes, we want to increase community involvement. We have to remember who the target population is, which is the homeless youth or homeless transitional age youth in the community. So let's break it down utilizing the acronym to confirm it out and see what we have at this moment. So we have identify clear goals and objectives that she would like to accomplish. So that is going to be an intervene. Why? Because it's an action to progress our own goals or an action on our end to try and progress the therapeutic process in some way. Continue to collect data to ensure that she has adequate evidence to back her goals. Since we're collecting data, it's going to be an assess because assess is collecting clinical data or measures to help progress the therapeutic process in some way. And then engage members in the community to help bring about change among homeless youth in our area. And since we're doing an action again, it is going to be an intervene. And then speak with homeless transitional age youth to better inform herself about the issue's feelings. Why? Because it's meeting directly with our target population, which is the transitional age youth in the area, to understand what they need and where they would like to go within the situation So we're meeting them where they're at. So the correct answer here is going to be D, speak with homeless transitional age youth to better inform herself about the issue. So that's how we look at that question in particular. Question 7. A community-based social worker has been trying to reduce the rate of drug-related overdoses in her community. The social worker implemented a self-referral based intervention to the members of her community, but recently had to shut down the program due to the lack of engagement. The social worker reached out to key stakeholders in the community and they agreed on the already established goals for the program. What should the social worker do next in this situation? A, reassign the roles of the members on the task force to increase engagement. B, reevaluate the goals and change them to what will be best for the community. C, change the layout of the program to ensure that it increases the amount of engagement. Or D, relaunch the current format of the program to help save resources in the long run. And when you have your answer, type the word tricky in the chat. Opening the polls. Twenty more seconds. Shutting down the polls. The majority think it is C. Second place is B. Third place is A. Fourth place is D. Let's look at it. We are a community-based social worker. We're trying to reduce the rates of drug-related overdoses in the community. The social worker implemented a self-referral based intervention to the members of the community, but recently had to shut down the program due to the lack of engagement. So not enough people were engaged at this time. So that's where we had to be mindful of. Lack of engagement is likely where we're looking at. The social worker reached out to key stakeholders in the community, but they already agreed on the established goals for the program that exists at this moment. So what should the social worker do next in this situation? So quick review: community-based social worker, reduce the rates of drug-related overdoses in the community. We have implemented a self-referral based intervention. So that's the current layout or framework that we're utilizing. People didn't engage with it, and now we talk to them and they already agreed on the established goals in the community. So keep those details in mind as we look at our answers, and then we'll compare the answers back to the question to see what we're looking at. at this time. We're automatically going to rule out D because we're not going to relaunch a program that had failed based on the lack of engagement, because something that hasn't succeeded in the past, we're not just going to blindly throttle down and do something again. So we need to learn from the past. However, we're also going to rule out B because the community already told us the goals that we have for the program are good. So we're not going to reevaluate the goals and change them based on what we think is best for them, because the community already told us, yes, the goal is reduce the rates of drug-related overdoses in the community. So we don't want to change what the initiative is about. So therefore, we either are going to do A, reassign the roles of the members of the task force to increase engagement, or C, change the layout of the program to ensure that it increases the amount of engagement. A is kind of blaming the people that are delivering the services. C is blaming the way that we thought we were going to deliver the services. So at this given moment, it doesn't say anything about the task force. So we're not going to just tell everyone on the task force it's your fault that no one engaged. We're changing roles right now. And we want to look at it and say, we have a self-referral based intervention, which means that people have to know out about us before they know about us in order to benefit from a program that we're delivering. So right now we'd go with C, change the layout of the program to ensure it increases the amount of engagement. We'd research what type of layout works best and how we can advertise and get people into our program. And so that way we can help accomplish the goal to reduce the rates of drug-related overdoses in the community. So the correct answer here is C, change the layout of the program to ensure that it increases the amount of engagement. So that's how we look at that question in particular. Question 8. A community-based social worker has been completing research around how to reduce the rate of domestic violence in his community. The social worker completed a needs assessment and found transportation, shelter, and childcare are barriers to help people seeking out and staying in domestic violence services. During a focus group that the social worker hosted, he found out that members of the community do not want to increase the availability of domestic violence resources. What should the social worker do next in this situation? A, develop goals and objectives for the expansion of domestic violence resources in the community. B, develop a task force team to carry out the program to help increase the availability of domestic violence resources in the community. C, review previous efforts of expanding domestic violence resources in the community to increase the likelihood of a successful program. Or D, reach out to stakeholders in other communities to implement our proposed program. And when you have your answer, type one thing you're looking forward to next week. Opening the polls. 20 more seconds. Shutting down the polls. The majority think it is C. Second place is D. Third place is B. Fourth place is A. Let's look at it. We are a community-based social worker. We're completing research around how to reduce the rates of domestic violence in the community. The social worker completed a needs assessment and found transportation, shelter, and childcare are barriers to people seeking out and staying in domestic violence services. So we've already did an assessment on the community and found those things are problematic. So we hosted a focus group. And during that, the social worker found out that the community does not want to increase the availability of domestic violence resources. So keep that in mind as we go through the navigating process. But quick review, community-based social worker, completing research around how to reduce the rates of domestic violence in the community. We did a needs assessment, so we identified the different resources that are existent there and the barriers and gaps in the system. We did a focus group, so we got the community together to get a focus on what we want to do. And we found out that they do not want to expand or advance the amount of domestic violence resources in the community. So, right off the get-go, we are going to rule out D because D is stepping outside of our community, which we wanted to improve our community. So we're not just going to say our community didn't want the program, so we're scratching that and going to the next community or that will approve us and do all of those things. So that is the first one that we'll cut right out. We also want to rule out developing a task force to carry out the program to help increase the availability of domestic violence resources in the community, because the task force would come after we have worked and identified the goals and objectives within the situation that the community agreed upon at this moment, but the community does not want to do it at this moment. So we're not just going to push past them and say, screw you. We've already identified our own goals and objectives. We developed a team and we're doing this whether you want it or not. So we're either going to do A, develop goals and objectives for the expansion of domestic violence resources in the community, or C, review previous efforts of expanding domestic violence resources in the community to increase the likelihood of a successful program. So do we want to look at the history and identify why this is kind of a mystery, why a community doesn't want to expand its resources? Or do we want to just go past what the community said and, all right, let's develop the goals and objectives that we feel are necessary for you guys, and you guys will adapt and conform to what we identify in this situation. So we're going to rule out A because we kind of want to look at like what's been done before and maybe previous efforts kind of like hardened or like jaded the perspective of the community about expanding resources like this. And we also want to make sure that we don't make the same mistakes as previous efforts. And maybe if we research the community a little bit more, it could help establish that rapport that we have with and for them to understand where they're coming from of when they don't want to expand such needed resources that we feel and see. So the correct answer here is going to be C, review previous efforts of expanding domestic violence resources in the community to increase the likelihood of a successful program. So that's how we look at that question in particular. Question 9. A community-based social worker has been trying to establish a drug prevention program for the youth in his community due to a recent overdose death of a 14-year-old female. The social worker has been receiving support from multiple businesses, organizations, families, and youth in the area. The social worker has collaborated with multiple stakeholders in the community, and they agreed to build a community center for youth to engage in social activities that do not involve alcohol or drug use. What would be the next step for the social worker to complete to develop the drug prevention program? A, Complete a needs assessment to better understand the situation before proceeding. B, solidify the goals and objectives for the community center to ensure that the community's efforts are focused. C, open the community center to the youth to allow for them to provide feedback on ways to change it to better fit their needs. Or D, develop a task force team to begin gathering resources and delivering services to the youth in the community. And when you have your answer, type one thing that you're grateful for right now. Opening the polls. Twenty more seconds. Shutting down the polls. The majority think it is B. Second place is A. Third place is C. Fourth place is D. Let's look at it. We are a community-based social worker that has been trying to establish a drug prevention program for the youth in this community. So that's our target population. And it was predicated on an overdose death of a 14-year-old female. The social worker has been receiving support from multiple businesses, organizations, families, and youth in the area. So they want this community center to go through. The social worker has collaborated with multiple stakeholders, aka people affected by this, in the community, and they've agreed to build a community center for youth to engage in social activities that do not involve alcohol or drug use. And what would be the next step for the social worker to complete to develop the drug prevention program? So, quick review, community-based social worker. We're trying to establish a drug prevention program for the youth in this community. So we're trying to develop something that has not been done before, predicated on a recent overdose death of a 14-year-old female. Social worker has been receiving support from the community, so they want this. We've collaborated with multiple stakeholders in the community, and they've agreed to build a community center. So it's not something that already exists for the youth to engage in social activities that do not involve alcohol or drug use. So keep that in mind as we navigate the answering process. So right off the get-go, we're going to rule out C because C assumes that we've already built it and established it in some way, shape, or form. So since they agreed to build it or develop it or establish it, we can't just open the doors to a community center that doesn't exist. We want feedback. We want people to engage in it, but we don't have it built or established yet. So it'd be kind of impossible to allow for people to go to it if it's not developed yet. We're also going to rule out D of develop a task force team to begin gathering resources and delivering services to the youth in the community because we don't really know what resources may be needed because we just have an idea right now. We've established the rapport with the community. They're open and willing to do this, but we haven't really found out what we have, what is needed, and what could be most beneficial at this time to help them get to where they want to go at this moment. So this is where we want to navigate the process and say, do we need to complete a needs assessment to better understand the situation? Or are we ready to develop goals and objectives for the community center to ensure that we're meeting the community's needs in some way, shape, or form? So this is where it gets pretty tricky because we've developed the rapport. We understand that people want us to build this thing, but we don't really know how we would do it, how much money we have to do this, where we're going to build it at, what resources we have, what activities would be available within it. So it'd be very difficult to identify the overarching goal and the objectives because remember, the objectives are how we are going to deliver services and things to the clients that we serve. So we're going to rule out B here because we want to complete that needs assessment to understand what currently exists in the community or what resources do we currently have or what social activities are available here and how would we implement those things or what could be needed. Do we need to do fundraisers? Where's the location going to be? How big's the building? Do we have a building in the community that we can utilize? So that's where we would want to definitely see what we would want to need or where we'd need to go because the key emphasis is we're establishing it so it's not already developed and we need to build it. So we may need to establish and build an actual building to make this thing happen. So we'd identify what is still needed and then we'd have a better idea of what goals and objectives the community would like to have in this situation. So the correct answer is going to be A, complete a needs assessment to better understand the situation before proceeding. So that's how we look at that question in particular. Question 10. A social worker in an outpatient clinic has been working with clients that struggle with addictions for the past 2 years. Throughout her work, she has realized a decent number of clients have had the same concern of not being able to afford food to feed themselves and their children. The lack of food has caused her clients to go without meals. For the past 3 months, the social worker has surveyed her clients' interest in utilizing a food bank if there was one at her agency. Most clients were interested. What should the social worker do next to organize a food bank at her agency? A, continue to engage the interest of her clients to ensure that the food bank would not go to waste. B, reach out to various grocery stores and people in her community to begin collecting food for the food bank. C, develop a schedule for the food bank to better inform her clients of how they can utilize the food bank. Or D, gather feedback from her clients regarding their experience with the food bank to make the needed changes for the future. And when you have your answer, type one thing that you learned from the session tonight. Opening the polls. 20 more seconds. Shutting down the polls. The majority think it is B. Second place is C. Third place is D. Fourth place is A. Let's look at it. We are a social worker in an outpatient clinic. We've been working with clients that struggle with addictions for the past 2 years. Any length of time, hop on top of it because it paints the picture of what we're looking at in the situation. And again, this has been going on for 2 years. Any length of time, hop on top of it. So throughout the work, we've realized a decent number of clients have had the same concern of not being able to afford food for both themselves and their children. And the lack of food has caused our clients to go without basic needs, which is nutrients. So the past 3 months, any length of time, hop on top of it because it paints the picture of what we're looking at. The social worker surveyed her client's interest in utilizing the food bank if there was one at the agency, and most clients were interested. So we were like, hey, would this be helpful for you? And they're like, yep, we totally want to be in on this situation. So what would be the next thing we would need to do to organize a food bank at our agency? So a quick review, outpatient clinic, clients that struggle with addictions. We've been doing this job for 2 years. We've realized a decent number of people have been going without food. They're missing meals. They would rather feed their children. So for the past 3 months, we've been putting our foot down and saying, would you guys benefit from a food bank? Because I wanted to establish one at the agency. And so that way you guys don't have to go without meals. Most people are like, yeah, we totally want that. And we would benefit from that in some way, shape, or form. So keep that in mind as we go through the question and rule out the answers. So right off the get-go, we're not going to be able to do D because the food bank is not established yet. We can't ask people for their feedback on utilizing the food bank if we haven't done it, because it says we're still trying to organize the food bank. So it'd be different if we had organized it, but at this moment, we're still trying to get the details ready and together. We're also going to rule out A because we've been gathering data for 3 months and people are interested, and it would be different if people weren't interested. So we wouldn't need to continue gathering that information because we know that they would benefit from it. So we don't want to assume that our clients aren't going to utilize the food bank in some way, shape, or form. We'd want to give them the benefit of the doubt, especially if we've been gathering the data for 3 months and they're still interested. So do we want to do B, reach out to various grocery stores and people in the community to begin collecting food for the food bank? Or do we want to develop a schedule for the food bank to better inform the clients on how they can utilize the food bank? So this is where it can be pretty tricky because the question only says that we have the interest of the people. We don't really have the food yet. And we don't know if the community is backing us. We just have the client's support and an idea that we have in our minds. So at this moment, we're not going to develop a schedule for the food bank yet because that's overzealous because we don't have the food to hand out. So we'd want to make sure that the community is okay with this. They'd be willing to donate. They'd be able to fundraise, etc. So that way we can maintain it and not just be able to pay for the groceries ourselves because we're on our own income and stuff like that. So we'd want to reach out to various resources in the community to see what we can gather so that way we can have a larger array rather than just ourselves. So the correct answer here is going to be B. Reach out to the various grocery stores and people in the community to begin collecting food because we have the interest and the rapport, but we need to see what we have in the community. So kind of a needs assessment and get the job done at that moment. So that's how we'd look at that question in particular.